Morning, everyone. My name is Aiyana Belguda, and I'm a special education teacher here in the district. My topic is, let's call it what it is, post-traumatic stress disorder in school-age children. So first, I would like to just start, just to define what PTSD is. So PTSD is a mental health condition triggered by a terrifying or traumatic event. So when you think about PTSD, sometimes you think about war veterans or people who've experienced natural disasters or people who've been in violent situations. Then I'll define what emotional disability is. As a special education teacher, I have taught students with emotional disabilities, so I'll just define that quickly. So according to Individuals with Disability Education Act, emotional disability is a condition exhibiting one or more of the following characteristics over a long period of time to a marked degree. So first is an inability to learn that cannot be explained by an intellectual, sensory, or health factor. Also, it's an inability to build and maintain relationships. Inappropriate behaviors or feelings under normal circumstances. It's also a general pervasive mood of unhappiness and depression. And lastly, is a tendency to develop physical symptoms associated with personal or school problems. Also, what's under emotional disability is schizophrenia. We don't talk about that a lot in our school-age children, but that is one of the factors. So if we look at this chart here, I just want to compare PTSD to ED. So if you look at the PTSD, some characteristics is agitation, hostility, mistrust, loss of interest, and hypervigilance. And then also looking at students with emotional disabilities, a lot of their characteristics are shown in the classroom is aggression, abnormal mood swings, difficulty building relationships, school problems, and excessive anxiety. Now, if we compare these two charts, you can see that they're very similar, just using different language. So we're saying that PTSD, people are agitated, and I can compare that to aggression. Sometimes when people are agitated, they may seem a little aggressive. Hostility, that's an abnormal mood swing. And when you have mistrust, you have really difficulty building relationships. When you have a loss of interest in PTSD, you don't really have interest in school, and that creates school problems. And then hypervigilant. People who are hypervigilant are probably suffering from some type of anxiety. So that's why I wanted to compare this PTSD to ED, because we need to really call it what it is. So the rationale, the reason why this is so important to me, because as a special education teacher who have dealt with students with emotional disabilities, I just felt that it was important, because I know people say, oh, you teach the bad kids, you teach the kids that don't nobody want to teach, you know? So I'm always that teacher to teach the kids who no one wants to teach. And we kind of can look at students differently if we can say these kids are traumatized. You know, when you look at a war veteran who's been in war, you know, we know that you have to have, you know, caring hands, or, you know, certain language you want to use. And I think we should lend that same sense to our students who have experienced lots of trauma. Also, teachers, we deal with adverse trauma. If we sometimes have our own trauma that we're dealing with and that hasn't been resolved, and a student comes in, they bring their baggage and their trauma, it triggers a lot. It leads to high teacher turnover, teacher burnout, teacher health problems. So just teachers dealing with students with trauma, it takes a lot on the educator as well. Also, again, like I said, the correlation between PTSD and ED needs to be highlighted for educators and people inside of the school. And lastly, we have the DCPS Social and Emotional Learning Initiative. I think that started last year. It rolled out with our former chancellor, now we have a new chancellor. But we were never, a lot of people were really not prepared for this. They rolled it out. We went to like 1 or 2 PD days with like 300 people in the room, but we were given like the one curriculum second step, but it was really never planned out or implemented properly. It was just like another check mark. We have this SEL initiative, but no one was really trained, including the social workers, including psychologists, including the staff and administrators. So one of my literature review I've read is an article called "When Students Are Traumatized, Teachers Are Too." I just took this graph from there because it kind of highlights the number of experiences that students nationwide, the traumatic experiences students experience. So if you look at the red, 4+ traumatic experience, 14% of students in this country have at least 4+ traumatic experiences in their lifetime. And usually when students have that much traumatic experience, it may impact their learning. That's kind of where my population of students come in, at 14% of students who have the, not intellectual, emotional disability. Is the very small, is the ones who always or have continuous trauma and it's impacting their learning in school. So the demographic from which I took this research was in an elementary school with 509 students, 3% English language learners, 100%, that's actually 95% economically disadvantaged, 22% special education population, and 7 students are have emotional disabilities, and 27% are in boundary. So there's just a little background. And then if you look at the pie chart, 81% is Black, Latino Hispanic is 7%, 8% white, 3% Asian, and 1% mixed race. So just to give you a background of where I'm taking this data. So my research tools, I had 20 respondents. It's kind of a small pool. I just did it at my school. So I had 8 teachers complete an anonymous survey. I talked to 3 mental health clinicians that comprised of 2 social workers at the school and 1 mental health clinician from Connected Psychology. It's a contractor who comes in and provides therapy for students who do not have emotional disabilities. It's just for students who have other types of problems in school. And then I had like 8 informal collegiate conversations just with colleagues who didn't feel comfortable filling out the survey, so we just talked about some of my survey questions. So my data analysis, I asked in my survey, how effective do you think school-based therapy is at your school? So from a teacher's response, so from 16 teachers, 50% think that it's somewhat effective. 25 think it's minimally effective, and 12.5 think it's ineffective. No one really think we have quality mental health therapy in our school. So some of the things that people were saying, they really believe that is not implemented with fidelity. It's just so much that the social workers have on their plates. They have to do homelessness, they have to deal with attendance, they have to deal with lunch duty, they have to deal with other crises. So they're not always able to give 100% of their therapy sessions with fidelity because they're always doing other things outside of their 7 hours of duty. So it's just not enough time. With the amount of students they have on their caseload, I think the average social worker, they have 15 apiece, 15 students apiece on their caseload, and some of these students have maybe 1 to 2 hours of therapy per week. So it's a lot that they have to do. Teachers also felt that, like again, they have, so they also think that some social workers need to be more trained in child development. So this is just what teachers think. Some teachers think that some of the social workers at our school are not fully trained to deal with some of the crises or students we have in our school. So that's from the teachers' responses. So from the mental health clinician, they were also asked how effective they believe school-based therapy is. And again, they said the expectations just are unrealistic. They have too much on their plate. They are also not trained for some of the behavior problems. They think that they just come for depression and other mental health issues, but they really are not trained with some of the severe behavior problems that they are forced to deal with. Also, they think that more teachers need to be trained and educated on the developmental development of children, that we don't always know how children grow, think, and learn, and some of their triggers. So they believe that teachers should also be more educated and trained. And they also think that that teachers should have more knowledge of teaching students. They need to be provided with more techniques and knowledge of how to support students with different types of disabilities outside emotional disability. So I also interviewed our social emotional lead at our school. We have someone who's appointed to be the contact person for any social emotional learning questions or issues at our school. So she just said that she thinks that it's nearly impossible to teach or train teachers how to deal with children's trauma if they haven't dealt with their own trauma. So she thinks it's difficult that if teachers come in traumatized, then they're triggered, and we need to try to deal with our own trauma first before we can fix the kids and help them with their trauma. But one pro that she did say that teachers are coming to her privately to ask, for some tips and suggestions with difficult students. And a con, she said, it's just a lack of time to do real work. Microwave PDs are rarely effective. We come in 30 minutes, then next week we're on to another issue. So that's just a problem I'm pretty sure is across the district. Some recommendations that I have is just to have professional development for teachers. It needs to be ongoing. It needs to be continual. It needs to be from outside experts, just not our social workers in our school. Teachers and staff should identify their own triggers and trauma and work on those, and have mental health, at the school for teachers and staff. Also, wraparound services for the most critical cases. Like I said, if I have 7 ED students in my school, most of the time their parents are dealing with some type of mental health illness. If we give them therapy in school, but the parents are not receiving any kind of therapy, it's like, it's a catch-22. We're doing all the work, but then when they go home, it's kind of not, being reversed. So just having wraparound services where a mental health clinician can come to the house, provide therapy, meet the family in the communities, and also have the therapist at the school. And also allocate funds to support mental health facilities in schools and communities. How many times do we see quality mental health facilities in Ward 7 and 8 and some of the wards with that we don't have access? And lastly, I would just like to continue additional research to include a larger sample size so I can see and we can all see how it measures up across the district. And lastly, May is Mental Health Awareness Month, so let's help break the stigma. And I know a lot, especially in the African American community, we have a stigma about therapy and going to therapy, and I know we have a lot of trauma in our community that we need to deal with, but I just feel like if we can get the word out to say it's okay, that I think that would make a difference. And I know that the chancellor just tweeted out something about mental health, and we have it in every school, but I do want it to be known that I don't think we're all prepared for this initiative.